Did Hayden Panettiere have health issues? Her depression, addiction, and recovery explained. Content warning. This video discusses depression, addiction, trauma, and serious health struggles. Hayden Panettiere spent much of her life in front of the cameras. She became a child star, a television favorite, and eventually one of the most recognizable actresses of her generation. But behind the success of Heroes in Nashville, Hayden was dealing with health problems that became increasingly serious. And after her death at the age of 36 on August 16, 2026, many people are asking the same question. Did Hayden Panettiere have health issues? The answer is yes. Hayden publicly spoke about postpartum depression, alcohol addiction, prescription drug addiction, anxiety, trauma, and serious physical consequences connected to her substance use. But there is one important distinction we need to make from the beginning. Her health history is documented. The cause of her death is not. Reuters reported that Hayden died at 36, with her family confirming her death through her publicist. At the time of reporting, no cause of death had been disclosed, and the circumstances were under investigation. So it would be irresponsible to claim that any of her previous health problems caused her death. Hayden's most widely discussed health struggle began after the birth of her daughter, Kaya, in 2014. She later explained that she experienced severe postpartum depression. What made it especially difficult was that she did not immediately understand what was happening to her. Hayden said she did not have negative feelings toward her daughter. Instead, she felt deeply depressed and described being in a haze that didn't feel like herself. She eventually realized that something was seriously wrong. But instead of getting the right help immediately, she began using alcohol to cope with what she was feeling. In a 2022 interview with ABC News, Hayden explained that she struggled to separate her postpartum depression from her growing alcohol problem. She eventually entered treatment and began working toward sobriety. And this was only the beginning. Her story became even more complicated because her character on Nashville, Juliette Barnes, began going through storylines that were frighteningly similar to Hayden's real life. The character experienced postpartum depression and alcoholism. Hayden was experiencing those same problems away from the cameras. In 2026, while discussing her memoir, This Is Me, A Reckoning, she explained that acting out those storylines could make it difficult to separate herself from the character. In other words, she wasn't simply playing a fictional woman going through a crisis. She was sometimes reliving parts of her own life while standing on a television set. And that made an already difficult situation even harder. Hayden's struggles eventually expanded beyond alcohol. She also spoke publicly about addiction to prescription opioids. She described how substance use became part of a cycle that was connected to emotional pain, anxiety, and physical problems. By her own account, things became so severe that she reached a point where she could no longer take care of herself properly. In earlier interviews, Hayden described serious physical consequences during her darkest period. She experienced extreme sleep deprivation, swelling, jaundice, and major changes in her appearance. She said her eyes became yellow and that she had to see a liver specialist. She also experienced significant hair loss and changes in her weight. At one point, she said doctors warned that her liver could fail. That detail is important because it shows just how serious her addiction had become. This wasn't simply a celebrity going through a difficult few months. Hayden's own descriptions make clear that her mental and physical health had reached a dangerous point. She eventually sought treatment again. She entered rehabilitation, participated in a 12-step program, and underwent trauma therapy. She later described spending months working intensely on herself and trying to rebuild her life. Recovery, however, wasn't presented as an instant transformation. Hayden described sobriety as something she had to work on every day. In 2022, she said she was sober and grateful for it while acknowledging that recovery was an ongoing battle. There was another major part of Hayden's health story that became public over the years: the emotional trauma surrounding motherhood and her daughter. Hayden's daughter, Kaya, was born in 2014. During the years when Hayden was struggling with addiction and postpartum depression, Kaya's father, Vladimir Klitschko, became the primary custodial parent. Hayden later spoke openly about how painful that decision was. She explained that she believed getting healthy was necessary and that her daughter needed stability while she worked on herself. Her 2026 memoir went into even greater detail about this period of her life. This Is Me, A Reckoning, published in May 2026, covers postpartum depression, addiction, recovery, trauma, domestic abuse, and the pressure she experienced growing up in Hollywood. And the memoir changed the way many people understood Hayden's past. For years, much of her story had been told through celebrity headlines and speculation. In the memoir, Hayden was finally able to describe those experiences in her own words. She also discussed the enormous pressure of becoming a famous performer while she was still a child. By adulthood, she had spent most of her life being watched, judged, and photographed. And she later connected some of those experiences to the emotional struggles she faced later in life. In a 2026 interview, Hayden explained that the storylines on Nashville had at times mirrored her own experiences with postpartum depression, alcoholism, and drug addiction. She said the boundary between herself and her character became difficult to recognize. So when people ask whether Hayden Panettiere had health issues, the answer isn't based on rumors. It comes directly from Hayden's own accounts. She had documented mental health struggles, she battled addiction, she experienced serious physical consequences, and she went through extensive treatment and recovery. But there is something extremely important to understand about Hayden's story today. Her past health struggles do not tell us what caused her death. Hayden died on August 16, 2026, at just 36 years old. Her family confirmed the death, but no cause of death had been announced in the initial reporting. That means any claim that her previous addiction, depression, liver problems, medication use, or another health issue caused her death is speculation unless official information establishes it. And that's especially important because Hayden had publicly described herself as being in recovery. In the months before her death, she was also actively discussing her past and her recovery while promoting her memoir. She spoke about motherhood, mental health, addiction, trauma, and the difficult experiences that shaped her. People who followed those interviews saw a woman who was trying to reclaim control over her own story. Her memoir was not simply a list of tragedies. It was an attempt to explain how she survived them. That may be one of the most important parts of Hayden Panettiere's legacy. She spent years being defined by headlines about addiction, custody, relationships, and personal struggles. But in the final period of her life, she was increasingly trying to define herself on her own terms. She wanted people to understand postpartum depression. She wanted people struggling with addiction to know that asking for help wasn't weakness. And she wanted her daughter to eventually understand the decisions she made during the hardest years of her life. Hayden's story also shows how complicated mental health and addiction can become when they overlap. Her postpartum depression was followed by alcohol abuse. Her substance use became connected to anxiety and emotional pain. Her physical health deteriorated. She entered treatment. She worked through trauma. And she tried to rebuild. None of those chapters should be reduced to a single label. She was not simply an actress who struggled with addiction. She was a person dealing with multiple problems at once while trying to recover in the public eye. And now, following her death, there is a temptation to look backward and connect every part of her history to what happened. But the responsible approach is to separate what we know from what we don't. What we know is that Hayden Panettiere publicly battled postpartum depression, alcohol and prescription drug addiction, anxiety, trauma, and serious physical consequences. We know she sought treatment and spoke about sobriety. We know she spent years trying to recover and rebuild her life. And we know that in 2026, she published This Is Me, A Reckoning, giving audiences her most personal account yet of those experiences. What we do not know, based on the information currently available, is the cause of her death. That remains a separate question. Hayden Panettiere's life was far more complicated than the headline suggested. She was a child star who became an international celebrity, a mother who faced extraordinary emotional challenges, a woman who fought addiction, and someone who eventually chose to speak openly about the darkest parts of her life. Her health struggles were real, her recovery was real, and her story deserves to be remembered with compassion rather than speculation. Because behind every headline was a person who spent years trying to find her way back to herself. And that may be the part of Hayden Panettiere's story worth